So as we go forward, I am honored to introduce you to our next speaker, Dr. Rob Valuck, who will be providing an overview of the major factors that have contributed to our current U.S. opioid epidemic, including the most recent impacts of COVID-19. His presentation will also include an update on new Colorado laws, regulations, and guidelines pertaining to controlled substances, and will give audience members an insight into the state's path forward in this work. Dr. Valuck is a professor in the departments of clinical pharmacy, epidemiology, and family medicine at the University of Colorado Schools of Pharmacy, Public Health, and Medicine at the Anschutz Medical Campus in Aurora. He is also the director of the newly formed Center for Prescription Drug Abuse Prevention at CU, which houses the state's opioid task force, the Colorado Consortium for Prescription Drug Abuse Prevention. Under his leadership, the consortium has evolved over the past 7 years to include 10 work groups with over 750 members across the state, focusing on key areas related to education, prevention, intervention, treatment, and recovery. The consortium has also gained recognition as a model for the development of collaborative, coordinated responses to the opioid overdose epidemic in the United States. And with that, Rob, I will hand it off to you.
Thank you, Lindsay, and thanks everybody for the opportunity to come and share with you this morning. Thanks, Chris, for your story. It's really powerful. Those are always very motivating and encouraging, I think, at least to me. So it keeps me engaged with this work. So I appreciate you sharing that. And it's also great to be back with this group. I wish, just like all of us do, I'm sure, I wish it was in person. Wish I could be in Steamboat. If anybody who lives in the city of Denver would probably agree with me. I would rather be in Steamboat. So I appreciate that. And I'm just really honored to be able to come share with you a little bit today. So my disclosures, have received various kinds of funding from federal, state agencies and foundations, even from a rural bank, co-bank, and private donations. But we don't take money, not even $1, from anyone involved with pharmaceutical companies or specific individual treatment or healthcare providers or payers, because we want to remain neutral, unbiased, and we're not working for anyone specifically. We're working for everyone is our goal. So that's how we approach our funding. You just heard my objectives. Thank you, Lindsay, for basically sort of summarizing those for me. I'm going to talk a little bit about the epidemic, the data, where we are now, a little bit about COVID impact. It's hard to even begin to describe all of it, but to try to start, and then let you know what the state is doing and end up with a call to action for your input on some things that we've been doing legislatively as a state. So let's kind of dive right in. The current data, I'm not going to do my usual talk, which is talking a lot about the opioid epidemic and that we have one and how big it is. I think we all know this, that if there is any good news, it's that we kind of are aware of this thing more so in the last several years. So I'm not going to spend a lot of time on it, but just so everybody knows, it still is a big deal. It hasn't gone anywhere. It's more than 130 people die every day from opioid-related overdoses in the United States. 50,000 2 years ago, and probably substantially undercounted. A lot of studies have come now from coroners and some sample studies that are saying the number could be 2.5 times that high, based on just undercounting with coroners and the lack of being able to really get accurate causes of death for everybody who could have been an overdose that is simply not counted that way. So lots of folks, and misuse is still very much an issue and the impacts of it. So this is just kind of a summary of what I used to spend half an hour talking about, that we kind of all know these things now, unfortunately. Overdose deaths in the last 5 years are continuing to rise across the United States. These are the most current data that I could get from earlier this month from CDC. And the provisional data month in from as recently as about February of this year is about the most recent data we have nationally. But we started to see some improvement, we thought, in the early part of 2017, and things were kind of slowing a bit. We wouldn't say really going down, but we're plateauing for a couple of years, and now are trending back up again. And this, we'd like to think it's because everybody in the United States has been working very hard to try to slow this growth. And the things that we're doing, we're having some impact, but it's really now kind of difficult because we're seeing, especially in the last year, these numbers climbing again. If you break those down by drug class, this is the number here for opioids is still the largest contributor is prescribed opioids. But the three drug classes that are concerning are synthetic opioids, or the dramatic increase in fentanyl-involved overdose deaths, and then both cocaine and stimulants. So methamphetamine, cocaine, and fentanyl are really increasing substantially over this last couple of years, especially. Obviously a concern. It's not just opioids; it's all substance use. Again, preaching to the choir here, but these are numbers we're looking at that are, of course, very frightening. And the more fentanyl there is in the illicit supply, the more the overdoses will become fatal. So very concerning, obviously. In Colorado, we've seen similar patterns here where, in 17, maybe early 18, we started to see a plateauing, and some people said we turned a corner and decreased. And I don't know that so much it was a huge decrease, but at least a leveling. And now again, in this last year or so, the increase. Colorado data are only available back for a couple of years as far as matching up with what the national standards were with measurement, but we're seeing the same things in terms of drug classes. A little bit of a concern in Colorado is that prescribed opioid-related overdose deaths are climbing at a faster rate than the national average. So the prescribed opioid overdoses are not decreasing or going away as we would hope. And also the same things you see here with the dramatic increase in fentanyl-involved deaths, stimulants, and methamphetamine. So overall in the United States, we're up about 9% year over year. From March 19 to March of 20 in terms of overdose deaths. Colorado is in above average, above that 9.1%. Ours is in the 10 to 12% range, depending on the county. A couple of them are very high, smaller size counties in terms of population, so the rates are affected by just 1 or 2 deaths. But again, a concern where we're not leveling off. There's a few places that are decreasing, but most of the country is increasing slightly, and about a 9% increase over the last year. So, what impact has COVID had? Again, we could probably spend all day just trying to parse this out and talk about it and see things. I picked just a few things. I was diving into this over the last month or so to try to prepare this talk, and man, there's an awful lot of information. A lot of it is obviously very recent, but it's, important things have come. Some leading indicators that I'm not going to present a lot of slides on, but pieces of it. Self-reported non-medical use, things from like the National Survey on Drug Use and Health and other surveys, up about 22%. Benzodiazepine and other anxiety drug prescriptions are up more than a third in the last 6 months. This is from pharmacy fill data and claims data from large aggregators, but up a third in 6 months is a dramatic increase in anxiety drug prescribing and dispensing, which tends to be, again, a leading indicator of the anxiety level of the population, and unfortunately tends to be very well correlated with disordered use and substance misuse. Alcohol use is way up. Sales are up dramatically, but self-reported use, always underreported, but self-reported use is up dramatically. Cannabis use up dramatically. Overdoses are rising, as we've said, and I'll mention again in the next slide. Toxicology aberrancies are rising. So, unexpected results on UTOX exams are rising as well. The rates of those hospitalizations and ED visits are rising a little bit less quickly, but they are coming. So we're seeing those. And then treatment visits in person were initially down and then steady, which is still discouraging. Anything other than treatment visits going up is a bad thing, because we know we still have a long way to go with closing the treatment gap. But anything where it's decreasing at first, obviously with COVID-related changes to try to figure out how to continue to deliver service, but then even keeping things steady is really, to me, it's difficult because it's not making progress, and we still have a lot of progress we need to make. Colorado drug overdose deaths in the first part of this year are up substantially. You see typically, month over month, maybe 60 to 80 overdose deaths, and it fluctuates a little bit, but not in the 125 or 130 range in a month. So it's really dramatic. And this, from the outset of COVID in February, again, really kind of striking how this increase is very dramatic. A report that I saw and looked at that, boy, it's another discouraging message to see, but the Wellbeing Trust and the Robert Graham Center of Family Medicine Docs, and some of these folks that we know, these folks, Ben Miller and Jack Westfall, who, as many of you may know, has done a lot of work in rural Colorado with bringing MAT into primary care and family. He's a family medicine doc. And Jack was involved in this report, but looking at projecting deaths of despair related to COVID-19 and the impact that it may have on deaths of despair. And really what the key messages were several. One of them was related to unemployment. We know that unemployment, we've seen the worst spike in unemployment since the Great Depression. So we've never seen this rate of unemployment increase in a century. And when we have that kind of a shock wave sent through our country, it has dramatic impacts on people, on all aspects of our society. We know the economic recovery is likely to be very slow, that it's much faster to have some cataclysmic event happen, whether it's a hurricane like Katrina, or if it's a pandemic, it happens a lot more quickly than the recovery does. And there's a lot of projections on how quickly will we recover from this thing? And will it take us, 2 years, or will it take us 4, 5, 7 years to recover from this? And there's different projections. None of them are terribly rosy, but it's, how quickly are we going to be able to do this? It's likely to be very slow, unfortunately, which sets us back in this field. Hard enough with when we were in a very good economic situation to try to expand services. But in dire economic times, it's even harder. And why is this all important? Because as we know, previous studies have shown that for every 1 point increase in unemployment rates, suicide rates go up between 1 and 1.6%. It's a tremendously impactful thing, unemployment is. The social isolation, the uncertainty with COVID, all of this are driving increases in suicides as well. The folks doing this report estimate the additional deaths in the next decade across the country are going to be very substantial. An additional mortality alone just due to COVID-19 and the impacts of COVID-19. And Colorado is believed to be in the upper, next highest quintile of states affected. Not unusual that the Rocky Mountain states, the Intermountain states have higher rates of deaths of despair. We do know that suicide is more prevalent in the Rocky Mountain and the Northern Plains and the Rocky Mountain states, where there's, isolation in our world is a little more than most of the country anyway, but still very, very alarming. Additional deaths in Colorado are projected to be about 25 more deaths per 100,000 population than already they were. The deaths of despair were already at 72 per 100,000 just due to despair in Colorado per 100,000. And then to add another third to that because of COVID is a large amount. I mean, it sounds like to me, it doesn't sound like a small number, but especially, add a third to what we already have in terms of deaths of despair, really kind of again, alarming. And this has been mapped out by the county level across the country. And you see, the western half of the United States tends to be worse in these anyway, but due to COVID, this is additional impact due to COVID in these populations. In Colorado, I'm sorry about this map being a little bit blurry. I'm trying to take little PDFs and blow them up into larger ones, and the graphics kind of aren't the most granular. But again, in Colorado, several parts of our state, which we know, the northwest part of our state, down into the western slope and the San Luis Valley and the part of the lower Arkansas Valley, but also including Adams County. So this is not a uniquely rural or urban thing. Deaths of despair affect all geographies. And here in Colorado, there are many counties, including some in the northwest here like Routt, that have anticipated very high rates of additional rates of deaths of despair that are projected. So again, we've got a lot to be focusing on, and we have to redouble our efforts despite the difficulties that we see with the economics. Speaking of which, we're all aware of this, that as of this spring, we have had a projected shortfall of over $3 billion to our state budget, which is a huge number. to try to overcome and deal with in our state. And that required a lot of austerity measures at the state level, which affects us in terms of what we're trying to do legislatively to grow and expand access to treatment. And whether it's prevention, intervention, treatment, or recovery, this puts us, sets us squarely behind the 8 ball when we go into a legislative session and we have a $3.4 billion deficit. It's really difficult. And our own OSPB, Office of State Planning and Budget, is introducing different scenarios too, because nobody really knows the answer to this, but what is the economic recovery going to look like and how long is it going to take? And so therefore, how should we project out spending and programming? How long should we try to project cuts for, and all kinds of things like that. It's very difficult, but I'm in contact with the folks at OSPB. I fortunately know the director, Lauren Larson, really well. And she does understand she has a very difficult job. How do you make cuts and balance a budget when we have a balanced budget requirement in our state constitution, and do it in a situation like this where we've got billions of dollars of deficit? So I do not envy her, but the decisions are difficult and they will affect all of us. So with that framing, it's like, boy, it's a little black rain cloud for me, right? But with that framing, we went into the legislative session last year. This is pre-COVID, obviously, in the fall, about a year ago, preparing for legislative session. Then we go into session 1st of January, 3rd of January. COVID is still not yet the issue that it is. That took another month, really, for us to know that it was going to have that dramatic of an impact. So we went into the legislative session with a plan to try to, again, continue to expand services and do things in several areas. And we introduced 5 bills that were from the Legislative Interim Committee on Opioid and Other Substance Use Disorders. We have an interim committee for this that most of you are probably aware of, and introduced 5 bills. As it turns out, we were basically told that as COVID became known and the impact we knew would be substantial. We didn't know how big, but we knew it would be big. And we were told if it isn't fast and free and really needed, nothing's going to pass. That's what we were told at the legislature. They're going to work on COVID relief and nothing else unless it was fast and free and urgent, which is, we argued that our stuff was urgent, but we were still arguing we need funding, despite the fact we know that we're going to be facing a budget deficit that ended up being $3.4 billion, but we were still arguing for this. So we passed several bills. One of them, unfortunately, did not pass, the prevention bill this year. We had bills about prevention, harm reduction, recovery, treatment, and criminal justice, but the prevention bill did not pass. The governor vetoed that one bill based on the first provision about insurance coverage for alternatives to opioids. He didn't want anything with an insurance mandate that could increase insurance costs even $1, so that people's premiums wouldn't go up at all, because we couldn't afford to have that happen in this situation, given the present situation. So he did not sign this bill. And it's unfortunate, because not only would it have been good to have some coverage for alternatives to opioids, like physical therapy and acupuncture and all kinds of other medications and all of that, but it took down the rest of the bill, which did a lot of other good things, like establishing competency-based standards for CME for prescribing opioids, continuing the 7-day limit for acute prescribing and the required PDMP query, and would have done the same thing for benzos. It would have added the first prescription limit on the very first prescription somebody gets for an acute condition to 7 days, and then have a mandatory PDMP check for continued use of benzodiazepines, which would have been, I think all of those things were positive. And everybody was very excited about all of this. We even had the insurance industry themselves was to neutral before this, and this bill got to the governor's desk. And unfortunately, he held on and did not sign this one. That actually vetoed this one. We did have successes, though, on 4 other bills. One of them was harm reduction, House Bill 1065. It extends immunity to people, some significant things for using expired naloxone. People talk about, well, I've got naloxone that expired a month ago. Can I use it? Can a law enforcement agent use that, or a citizen, anybody, use the naloxone if it's expired? We tell them, absolutely, use it. Now you've got legal immunity if you use it in good faith and didn't have access to something else. Go ahead and use it. And now you're immune under Colorado law from prosecution, civil or criminal, which is fantastic, because the stuff is really practically indestructible. I know a lot of people doing studies on naloxone stability that see this stuff that is still stable, that they've been testing since 1992. I'm not kidding. That we have samples that are that old, and we still test them, and they're 96% potent and no issues. 25 years old. in that stuff, and the expiration date is 2 years on it. We're working on extending that. The patent life, or the expiration date now, the FDA says we're going to be able to extend that to 3 years instead of 2. So there's positive developments there. We did get a requirement that hospitals be reimbursed for take-home naloxone, so insurers have to cover it. It used to be they didn't have to if the hospital didn't administer the naloxone to somebody. Now they can cover it for giving take-home naloxone from the emergency room or post-discharge, post-surgical, whatever, which is fantastic because now there's coverage and hospitals have every reason now to go ahead and do this and not be faced with having to cover the cost themselves. Also permits pharmacies to provide syringes without a prescription. They already could really, but now this provides affirmative language and statute that they can do this and sell syringes to anyone without prescription. And it requires them to educate people on naloxone. And it also removes barriers for syringe access programs by removing county level public health board approval. And the state now can issue approval for new SAPs, syringe access programs, by a state application rather than local county public health boards, many of which were reticent to approve these programs, despite the overwhelming evidence that they're successful in spreading stopping the spread of communicable diseases like HIV, Hep B, Hep C. So it's really, that was very important. So some good advances in harm reduction. Treatment also was successful. We got several provisions passed. One, to require insurers to provide coverage for the full continuum of substance use treatment, that they have to have some form of coverage for every aspect of medical withdrawal management through the spectrum all the way to sustained recovery support services. Now it's going to be varied on how that gets implemented, but it was not even a requirement to provide the continuum of care before. Now there is. They have to provide coverage for at least one form of naloxone. They cannot deny access to services based for people on Medicaid assisted treatment. There's provisions there as far as treatment centers being not able to deny people if you're on MAT, which we think is significant, that some people need MAT, some may not. While there are many paths, and we agree with that, if there's a doctor and a patient and a family that believe that's the best thing for them, that they're on MAT, they should be able to continue that no matter where they go. Just as though if they think the best way to manage their diabetes is with a certain medication, they should be able to continue that medication no matter where they go. And then it updates the civil commitment process as well. There were some difficult provisions and hoops to jump through for civil commitment for people. The next bill, and the governor signed that into law. Next bill is criminal justice, House Bill 1017. And what this did was several key things. We know that the period immediately after justice involvement, immediate post-incarceration, the 2 weeks after, are among the highest risk times anybody could ever face. Leaving that setting and returning to, if it isn't a very new environment, and most often it isn't, is a super high risk time for people. And this ensures several things: Medicaid enrollment upon release from jail. Started a program of safe stations for disposal of controlled substances. Allows for sealing of records for a person completing substance use treatment to allow them to have protections and privacy, and encourages access to MAT in jails and corrections. Stops short of requiring it, but encourages it. And we're working very hard, and you'll hear more of that from other people later that do a lot more of this work than I do. But it's super important. One of the biggest need areas that we face is MAT in and after incarceration. It will save a lot of lives. There's no doubt about that. And the governor signed this. So we're making progress. This isn't the full distance we need to go, but we're making progress. The last two are the recovery bill and then a related bill on COVID support. Senate Bill 28 on recovery did a couple things. It continued the study committee every other year. Next year it's going to be focusing on COVID impact this next year, but then afterwards, we believe this interim committee has been so successful that we didn't want to break up the band just yet. You know, we think there's some more hit albums in this band, that we've got some more hits that we can create. So the band is going to stay together for a while longer. And it also modernized the definition of child abuse and neglect in statute, so it isn't quite so onerous or unreasonable for families, especially for pregnant moms and newly delivered moms. So that was important. The last bill that was related, it wasn't an interim bill, but it came along during session, was to allocate some of the money that came from the CARES Act, federal, to COVID-19 behavioral health relief. And it was about $15 million worth. of money from those federal dollars that Colorado got, about 60 million, and to put 15 million towards behavioral health related issues due to COVID-19. And this was for a variety of purposes that the legislature set this out for, everything from substance use treatment and recovery providers, so some recovery money for treatment and recovery, some for community mental health centers, treatment for school-aged youth, crisis services, co-responder programs, school-based health centers, a little bit for the naloxone bulk purchase fund, small amounts for behavioral health training for school personnel, some amount that we were able to protect for some of our consortium programs for health professional training, a grant writing assistance program that's been very successful, and PPE and telehealth supplies for MAT providers that are underfunded programs that we help fund. And then a little bit more for the Safe to Tell program and SBIRT. So to distribute this, it's hard. That's not, 15 million is not enough, but it was something to try to help bridge some of these programs and keep them going. After all this work gets done and we decide, we pass all these wonderful new things, then we get hit with the budget forecasts and the budget that came out in May and said, okay, now we have to cut the 3.4 billion from the budget somewhere. And everything, basically virtually all of the money that we were talking about, it was proposed that virtually everything we were talking about that would get cut, and that this would cut almost every program that we had created over the last 2.5 years was the proposal. And the proposals were to cut $43 million in substance use prevention and treatment related programming that we had fought for over many years. But through a lot of advocacy, through Senator Pedersen, Representative Kennedy, members of the JBC, Senator Moreno, I can't say enough about him, Vice Chair of the JBC, to fight for this. We protected about half of this money that was going to get cut. And for us, that was it doesn't sound good to lose half of your funding, but when the alternative was to lose all of your funding, we felt it was a win. And a lot of other areas got completely cut to save that money, that kind of deficit. So I'm not going to go through all these because this is like an eye chart here, but it does kind of show you all the proposed cuts that what was recommended by the JBC at the bottom of the middle column, this $43 million proposal to cut everything. And eliminate a lot of things that would be, treat, like, for example, 5 million in treatment for rural communities was on the table to be cut. And what could be salvaged in other ways. So there's a lot of things in some of our other programs, but we got this to about half. And so we were happy that we were able to preserve a lot of things that we thought were going to completely go away. Important things that were salvaged were Senate Bill 19001, which is extending out Senate Bill 74 from 2 years ago, is the MAT in rural areas, including Routt County, Pueblo and Routt, where this funding started from Senate Bill 74 3 years ago. And we continued that so that those programs could continue this year and next year. They were going to stop that immediately and roll back and claw back last year's funding is what they were talking about doing, which would have been horrible, because we know that, over 100 people in Routt County receiving services that weren't before. And in Pueblo, this was over 900 people receiving services that weren't before because of that funding. And this extended it to the San Luis Valley, other counties in Northwest Colorado, some of them over in Delta and Montrose, areas of the state that we know have high need. You saw the maps, we've all seen the maps, and we did not want to lose that funding. And we fought like heck. I was texting JBC members during the hearing, do not cut this bill, or this people will be, will not receive services, and many of them will relapse and die. And we managed to keep it alive. So we were very excited about that. We were able to get the new Medicaid bill that is basically from a couple of years ago to establish Medicaid coverage for medical withdrawal management, inpatient residential treatment, was going to be delayed for implementation for a full year. Only that was cut to about 6 months delay in implementation. So early next year, you've been seeing some of the stuff about this, that the new Medicaid coverage with detox inpatient residential is coming, which is fantastic. We've needed this. That was all the other big need area was Medicaid coverage, and we needed this for MAT in jails and some big areas we're making progress. Public awareness, SBIRT, and the Circle program were reduced but not eliminated. So those were successes, not to have them go away. And many components of these bills are remaining, which is good. The state opioid response funding from OVH is covering some of these gaps. Luckily, the feds have increased funding to the states by about 30%. So for the next 2 years, Colorado is receiving over $41 million to OBH to help with this problem. And they're also doing a lot across the continuum of care to try to fill some of the gaps that were cut. So our OBH folks like Robert Werthlein, head of the agency, and Mark Condagiani, who many of you know, these folks, worked with the legislature to figure out what's getting cut, what has to get cut, what can OBH fill in with federal dollars to try to minimize the impact of the other 22 million that was cut. So we're trying to not take steps backwards from all the gains we've made over the last several years. And I say all the gains, we still have a long way to go, but we cannot afford to take steps backwards. But we appreciate all that OBH is doing to step up and fill in gaps and try to help these problems. Last thing I want to end with is a call to action for you is many of these bills that you hear about from the Opioid Interim Committee have impact in your community and all communities in Colorado. We're collecting feedback right now to give to the AG's task force, in turn to give to the legislature about how well are these bills working, what is working, what isn't working. So we have a survey that has been put together that you can respond to if you like. Nobody's required to, but we would love to have you respond. It's people in the community delivering services, receiving services, anyone that's connected to this work. And how is it working in Route and in Northwest Colorado? Feedback is, unfortunately, it's due next Tuesday, which I call National Political Feedback Day. So this is your chance to have more feedback, express your views on all matters political. So please, if you haven't voted, vote. And then give your votes on this. So Lindsay will forward a link. We created a link in an email for people from this to send out so people can give input if they're interested in how are these bills working, what do we need more of and less of. And then just thank you to everybody. Many of you, I couldn't find one picture that has everybody involved, but Senator Pedersen here, Representative Kennedy, many of you, JK, you're over there, you're tall. I can see you in the back of this picture, JK, so you're in there. And then Senator Moreno, I mean, people that are really doing a lot of this work. It's best picture I could scare up. So I appreciate that. And if anyone has questions, we're happy to take a few, and we're always available for input and to work with you and your external relations specialist that lives in Steamboat and is there, Lindsay, which is the very reason we hired her, was to be able to have someone who is from Northwest Colorado serving Northwest Colorado. So we're thrilled about that and the work that Lindsay is doing with you. So thank you very much.
Thank you, Rob. We really appreciate it. There is a question in here. It says, where can we find how our specific senators and representatives voted on these funding issues so we can contact them to let them know this funding is critical in our communities?
Yes, and I think the record on for the bills, when you have to look at each specific bill. I think with the long bill, which is the budget, you can look to see who voted which way. Really, it was the JBC, and you can look to see who the JBC members are and how they voted. If you look at the long bill on the JBC website on the Colorado General Assembly page, the single best thing you can do is talk to your legislator or the members of the JBC to tell them how important this is, and that the funding simply can't be cut. We know that funding has to be cut in certain places, but I was arguing, I know the roads are bad. I'm willing to deal with a few more potholes. I'm not willing to deal with people losing treatment. I can deal with a pothole and even a flat tire if I have to. I cannot deal with people getting cut off of treatment for use disorders. That's not acceptable to me as a trade-off. So please cut the roads, protect the treatment funding, and things like that. And they do listen, especially to providers. You are in a very strong position that you probably have no idea how strong your voice is to legislators that I provide services and this is what I need. Or I received services and I'm alive because of this. And it impacts them. And that it was just a few texts like that saved Senate Bill 1. It was remarkable. So I've seen it happen. And if people don't think that 2 or 3 text messages from the right people, someone with lived experience, a treatment provider, and then one person like me who's just an annoyance, and I'm just a constant burr under the saddle is what I am. But put those 3 things together and 3 text messages save that program. So don't think that you can't have an impact. Be as vocal as you can be. And I'm a reluctant political activist, believe me. The last thing I thought I would ever do would be politically active. I do not like it. but it's a necessary thing. And if we don't advocate for ourselves and the populations that we serve, no one's gonna if we don't do it. So I encourage you to do that. And they do listen. The good news is they listen. And our legislature is getting informed about this. And the interim committee is talking to other legislators and they're getting informed about this. So we have one of the most informed legislatures around the country about this topic, which is good. The news isn't good with the budget, but they get that this is a problem and they get that we have to have bipartisan. Most of these bills pass with strong support. You know, these are not party line bills. Most of these, you know, kind of things in committee, we see these, you know, 9-2, 10-1, 11-0 votes, and which you don't see on most bills. I mean, even if it's a good idea, you don't see 10-1, 11-0, and we get a lot of those. So it's, you know, our legislature is a good bunch of people. We just need to help them and remind them how important this is.
Rob, two more questions. Duke Rumley from Sober AF asks whether or not the grant writing assistance will continue into 2021 and just notes how helpful it's been for him.
Yep. And thank you, Duke. I owe you an email. I know it's in my inbox. You get the answer probably is that I've been so busy preparing for this, I didn't have a chance to call you, but thanks for the question, Duke. And I'm glad, that it's successful. We think it has been tremendously successful. We've spent about $225,000 total and returned 20-1 ROI for the you know, nonprofits and harm reduction agencies and others around the state that have taken advantage of that funding. We do have some of the funding continuing for the short term, as I can promise it will continue for the short term. We have enough to continue us through this next several months up until next summer because of the CARES Act money that we got a little bit set aside for this. And it was viewed as essential under COVID that people be able to apply for these grants to keep them alive as an organization. And if they didn't have that, COVID would shut them down. We made that argument. The state bought it, the feds bought it, and so we have the funding for now. Beyond next July, I don't know because of all the uncertainty of this, but that's what we're fighting for, is to keep these programs alive. And it was one of those budget line items we did save for this year. So we were successful for this current fiscal year. Beyond that, I'm gonna work like heck and see if I can't get it going another year, because it is wildly successful. We had no idea how successful it would be. And it's a really good program. And we wanna help organizations like yours to continue with that program.
On that note, JK just commented that he actually just received another roughly 200,000 from Caring for Denver, which is an organization that provides outreach and treatment for women, including trans women. So it is a great program, and we will go ahead and put a link in the chat box so that all attendees can access that grant writing assistance program and learn more about it. Matt Stenslin from Front Range Clinic wanted to know if you could give an update on the lawsuit settlement dollars headed to Colorado and how those will be used.
Yeah, it's a good question. And right now there's a lot of lawsuits happening. There's the feds have sued the manufacturers, wholesalers, distributors, and pharmacies, you know, at all the levels. And the feds have sued them at the DOJ level. They just settled last week. For a relatively small amount of money, but they wanted the companies to admit guilt and admit culpability and then not take too much money at the federal level and let the states and municipalities have that money, which I thought was very good. So they took a small fine, which was not insignificant. $275 million is not nothing, but it's not what's going to have to come out to the states. Now, the next two levels of suits are the multi-district litigation that the states have, the AGs, and that many counties have been consolidated into, a couple thousand counties have consolidated into a multi-district litigation, both of them in federal court, district court in Cleveland. And those are both in negotiations for settlement. We don't know if they're going to settle. There's proposals on the table for settling both of those, the state lawsuits and the county lawsuits. And they're in the range of $10 billion spread out over a period of time, which I think is A, abysmally low, B, spread out over too long a period of time. But the companies are claiming they're already in bankruptcy court, like Purdue Pharma is already in bankruptcy court and has protection for several months, at least while this is all happening. So we don't know exactly when it will happen, but it's likely to have some amount of settlement, probably in the next 6 months is what our AG has said, probably, but nobody knows for sure. But when those come, we've been working with the AG, and the AG's office, Heidi Williams, has been working to go around the state and listen for, get input from folks. We have been giving input, a lot of folks have, to them about what some appropriate uses and really high need areas are for that potential funding. And the AG's office is working on how to set up a regionalized model for maybe distributing funds as they come back to regions of the state to be able to use them as they see fit within a range of purposes that would be defined as appropriate uses, and then let the regions figure out, do we need more for this or that or this? What combination of ways would we spend this money in the regional areas, knowing that there's differences. Obviously, Northwest Colorado is very different from the San Luis Valley or from Metro Denver or from the Four Corners. They're all different. So we need to have some flexibility. So that's the latest I've heard, but that was just sort of parroting back what the Attorney General said last week at our annual meeting, is kind of his answer. So I'm waiting, just like you are, to hear more on when would those things settle, when would money start to come, and how would it get distributed. But that's the latest that I've heard.
Rob, there's one more question in here, whether or not your slideshow would be available so that people could use the statistics to help continue patient advocacy.
Absolutely free. I'm a big fan of R&D, rip off and duplicate. So I'm equally going out the door. Anything I've compiled, I hope people will take this and share it. So I've already provided a copy to the organizers, a PDF of all the slides, and yes, you may use them all you want. Don't even bother giving me attribution. Just use the data. Go convince some people that we need some more help. So yes and yes.
Perfect, thank you. So as we follow up with a recording from today's meeting, we will make sure that we're providing some of these links, including the grant writing assistance, the surveys to be able to respond regarding how legislation is working. And then we will make sure that we're also providing copies of the slides that Rob presented so that you have access to those and can use those as well. And at this time, we don't have any other questions. So we will say thank you so much and move on to the next presenter. Thanks again, Rob. We appreciate it.
Thank you, everybody. And thanks for all your hard work.